Normal, sir.
Okay, any comment from Zamboanga as to the need for a paraclinical diagnostic procedure? Dr. Chong?
I just wanted to ask again why he considered first earlier in his statement to do final evaluation on his patient.
Would you like to amplify that, Dr. Douglas?
I changed my mind regards to the diagnosis. That's why I correct myself.
Does that would you follow up on it? Okay, the next case, we have a 50-year-old female married with breast masses on the right and left, 2 centimeters each, not hard, slightly tender, no erythema. The masses are movable with well-defined border. There is no axillary node. Can I have your clinical diagnosis, Dr. Kalumba?
At this time, I would be considering pharmaceutic changes or disease of the breast.
Any disagreement or all concur with the diagnosis of fibrocystic disease or changes as given by Dr. Kalumba? Arnel? Do you agree, Arnel? I repeat the data. 50-year-old female married. There are breast masses on the right and left, and these masses are 2 centimeters each in size, not hard, slightly tender, no erythema, movable, well-defined border, no axillary node. Ayan? Any different diagnosis? The chief from Boa, Dr. Boa.
Doctor, I have a different diagnosis of this patient because the patient presented with bilateral breast mass. It was described as 2 centimeters each, not hard, slightly tender, movable, and with well-defined borders and no axillary nodes. My diagnosis here would be fibroadenoma.
Okay, fibroadenoma, fibrocystic changes. Now Richard will give his clinical diagnosis.
I agree with your clinical diagnosis.
Any other different clinical diagnosis, either from Tondo side or Zamboanga side?
I would like to correct my answer a while ago. It was a fibrocystic change or changes or disease to fibroadenoma. I am still considering more of a fibroadenoma.
So we have only one answer now, fibroadenoma. Any other answer?
It's the same.
Sa? The same?
I have also the same clinical diagnosis, which is fibroadenoma.
Okay, in the presence of multiple masses, what's your differential diagnosis? If it were benign, you're considering benign lesions. What could be a close differential diagnosis? Dr. Kalumba.
For multiple masses of the breast, doctor, our differential would be fibrocystic changes of the breast. This would be our primary differential diagnosis.
Usually, do fibrocystic changes reach up to the size of 2 centimeters hidden?
No, doctor. We usually start as realignment masses
So what is a condition related to fibrocystic changes that will present with a palpable, clinically detectable mass? And then, what is a condition that is related to fibrocystic changes that will present with a huge mass or clinically palpable mass? Because as you said, fibrocystic changes, they don't usually present with a mass as big as 2 centimeters.
I think we would be considering benign cystocercomaculosis.
Okay, is it very common to have cystocercomaculoides on both breasts? Hidden?
Usually it is presents as a unilateral mass, but it can also appear as bilateral mass to the breast.
Okay, what is another close differential, another differential diagnosis that in a patient presenting with bilateral breast masses, 2 centimeters each, which you think is benign? In there.
We can consider also that other benign conditions like TB of the breast, because TB of the breast does not only affect one breast alone, it can affect both breasts actually. So I think this can be included in our differential diagnosis.
Any thought on this, June? Burgos?
I think I disagree with your last diagnosis, the tuberculosis of the breast. Because usually this condition presents with multiple sinuses in the breast.
So what would be gross differential after fibroadenoma, June Burgos?
With these two CMS bilateral, I think the most likely is fibrocystic changes.
Any refinement that you want to make, Dr. Chong?
The fibrocystic changes already mentioned, differential, from myeloma. Although the tuberculosis was mentioned by Dr. Paloma is not likely this patient. The other condition that I could think of, aside from the benign, is the not considered malignant condition also on this patient.
Okay, has anybody thought of possible macrocyst in this patient? From Boga side? Jan?
So, my diagnosis in this particular fibroadenoma, because of that, the bilateral 2 centimeter mass, 25 borders, and macrocyst. This is physical examination. The only BB that can point to macrocyst is that of slightly tender and bilateral 2 centimeter mass.
Okay, about Tondo side. About the diagnosis of macrocyst, is it very likely this particular patient? Rex?
Yes, doctor, I will agree. Macrocyst could present as slightly tender, well